Welcome back to the program. 21 minutes after the hour on First Amendment Friday. Let's start with a candidate for public office in the state of Washington, Craig Riley, running for state representative in District 49. How you doing, Craig?
I'm doing great, Lars.
You ready for the questions?
Yeah, go.
Probably the biggest question is jobs. What would you do as a state rep to enhance the ability of businesses to form and jobs to be created in Washington?
All right, we need to take a long-term approach to this, Lars. The problem that we've had is trying to do a quick fix. We need a paradigm shift, and that shift is specific to regulations. We even see Obama here in the last month or so getting on this platform and stating, hey, we need to deregulate, and he's done a minimal amount. But this is what is infectious and has been infectious for the last 20 years across the nation, and we're terrible here in this state. If you look, it's kind of interesting.
Why does it have to be long-term, though? I mean, why? The president just announced today he's killing some ozone rules that were going to kill jobs. Does that have to take a long time if we're really in a crisis?
Well, we have to wait for the session to come up, which is going to be in the spring of next year.
Yeah.
Okay, so that's number one. And number two, you have to have the laws implemented, and then you have to have new regulations. It's easily going to take 2 years to have this done, but at least we'll get things moving. And let's take a look at example, Department of Ecology. The only department where there's been growth. Everything else has been cut here in the state. It's the only department that has had growth in the number of employees, and there's 42 full-time rule makers. This is oppressive.
I agree.
We can't have that.
I agree. No, that's a good answer.
What industry you look at, we're having this problem.
Okay. How about the bridge? What are you going to do on the bridge, and will you block the funding of the bridge in Olympia if the voters vote no in Clark County?
Yes.
So no funding.
The reason being is I do not believe in build it and they will pay it. All right? We don't do it personally. We don't do it in business. Why should the government do it? And it's not that we don't need a bridge. It does not that we don't need to solve our congestion problems or our freight problems in commerce. But I feel the one partner in this whole project that has really failed us is the feds. They have dumped this on the backs of the local people, particularly Clark County, because we have most of the commuters. 2/3 of the commuters are right from our hometown here. And they're going to be paying tolls on this thing. And the public-private partnership is things that it's out there. We've got to do it. We have to pay user fees. But to pay user fees for something that is poorly designed and poorly planned is not appropriate. And I know they spent a lot of years on this thing, but how in the world, after 10 years, can they be so off as to say $5.50 tolls round trip? Oops, sorry, 2 days later, the Oregon State Treasurer comes out and says that's only going to cover half of it. You and I wouldn't buy a house and do that.
Nope.
Oops.
Nope. In fact, should the bridge be built the same size? They're talking about 3 traffic lanes each way. The current bridge has 3 traffic lanes each way. Should the bridge be bigger for cars?
Well, let's say we have to acknowledge the fact that they are going to have some on and off ramps that lanes actually that are going to add to it for safety's sake. But
those are on and off ramps. But should there be more traffic lanes for cars?
I'm not an engineer, but all I got to say is, why is it that there's 8 bridges in Bridge City down there in Portland going across to Willamette, and yet for a key corridor of transit, such as over the Columbia River, we only have 2? I think that answers enough. We need more bridges.
Should there be light rail on it?
I don't think light rail's not critical. What's critical for us right now is solving the congestion problem, and light rail only serves about 7% of the population. That it just doesn't make sense.
Should light rail be taken out of the engineering? Because as I understand it, you'd save potentially billions by taking the light rail component out and say we're just not going to build light rail, which has been voted down twice in Oregon, once in Clark County.
Well, of course, you're talking about the feds saying that they're going to support us with 1/3 of the project cost. That's not true at all. $450 million is actually going to go into the bridge infrastructure, but $800 million of that is going into the light rail, and that just doesn't make sense. We need that $800 million to going into building a bridge or multiple bridges. We need to do what is most important. And I'll tell you this: if we have a vote here, and that's what we need, if we have a vote here and it's no, I will, on my own buck, go there and lobby the feds and tell them, look, we need to redesign, relook at, refinance this whole project.
Healthcare is the other issue. The Supreme Court just gave the Attorney General permission to sue to block Obamacare from Washington State. Would you back that up?
Well, sure. Now that's the Supreme Court here in the state of Washington.
Right.
Said that Rob McKenna was right on target, that yes, he does have the right in his office to represent the people of Washington if he feels like something's inappropriate, and this is inappropriate. The problem, let me tell you, Lars, the problem, healthcare is what I've done all my life. My father's a doctor. I've owned and operated nursing facilities, home health agency, ambulance companies. I know what it takes to operate and deal with healthcare. And the problems, yes, they are there. And there's no easy answers. But one thing is not an answer is having a plan, such as health reform, that's going to put 50% of the uninsured onto Medicaid. And who's paying Medicaid? It's you and I.
Would you favor any plan that forces people to buy insurance?
No, I'm not into forcing people to buy insurance. However, that does create a problem when you have guaranteed issue and everyone is getting on regardless. I mean, it's just like saying, hey, would you buy a car where the transmission's going out? Sounds heartless, but that's the truth. You cannot have a system unless you have some type of screening. But people think that there's no access. There is access. In every single state in the U.S., there is an uninsured pool. That means those people who cannot qualify. All we need to do is help them purchase that. I mean, if we're talking about solving this problem, we didn't even have to create this huge bureaucracy. All we need to do is flow money back to the states. They all have basic health plans. Every single state does. But the real problem, to get back to Medicaid, because that's what we got right now, unless this is defeated by Rob McKenna at the federal level, is that we have these people going on to Medicaid. But, the doctors are only reimbursed about 19 cents on the dollar compared to your private pay. They are not going to take them. And I deal with these patients every single day trying to help them find a doctor. That's what I do in my business. If they don't have access, what have we provided? We provided them a plan, an insurance plan, but no access.
I'll tell you what, let me ask you this. As one positive reform, since I'm not just going to be against Obamacare, would you propose to the Washington legislature, if elected, that people in Washington be able to buy their health insurance from any other state they want to buy from? Because right now they're limited to only buying what's sold in Washington state.
Oh, yeah, there's no question that, but then we have a problem with mandates, okay? Because in this state we have different mandates than in Oregon, and certainly different mandates.
Should we have any mandates?
Pardon, say that again?
Should we have any? We're going to run out of time, but should we have any mandates, or should we leave it up to the consumer to decide what he wants to insure?
We should leave it up to the consumer.
I appreciate it. Craig, tell folks what your website is.
It is vote4CraigRiley.com. So
vote4CraigRiley.com. Good luck to you.
Hey, thanks, Lars.
You bet.